started. Hi, everyone. Good evening. Hope you're all doing great. Welcome to today's informational webinar about the CCALAC Allied Health Internship Program. Welcome. Thank you again for joining us. We're going to go ahead and get started. Again, this informational webinar will be recorded and will be posted on our CCALAC website, along with the application and all the program information. Next slide. All right, so the agenda for today's webinar is we're going to start off with introductions. We're going to do an overview of CCALAC so you understand a little bit about our organization. We're going to do the program overview and timeline. We're going to go over the application process and requirements, as well as program expectations, and then we'll take your questions at the end, and we'll do our best to answer those questions for you. So starting off with introductions, my name is Alexander Gill. I go by Alex. I am the Assistant Director of Workforce here at CCALAC. My pronouns are he, him, and I am excited to have you here. Welcome.
Hi, good evening, everybody. My name is Andres Sanchez. I am the Workforce Program Manager, and my pronouns are they, he. I've been at CCALAC for about 3.5 years.
Hello, everyone. I'm so excited for you all to be here. My name is Crystal Torres. I'm the project coordinator here at CCALAC. My pronouns are she and her, and I've been here for almost 4 years, or about 4 years.
All right, so we're going to begin by telling you a little bit about who CCALAC is. So as an organization, we were founded in 1994. We became a nonprofit in 1996. Our membership is comprised of 65 member clinics that serve about 1.7 million patients all over the county, and those sites have about 300 clinical service delivery sites all over LA County. So we're a pretty large association, and our clinics have definitely quite a few sites all over the county. So they provide a lot of different services. CCALAC, as you can see on in the presentation, our mission, vision, and core values are really important part of our foundation. Our core values consist of partnership, innovation, integrity, service, and equity. And we try to deliver try to deliver these through the service that we provide to our clinics and the through training, through education, and other roundtables and webinars, meetings, and things that happen as part of CCALAC. Next. One of the things that we've been working on in the last 2 years has been our anti-racism organizational change initiative. CCALAC strives to be an anti-racist organization, and we are building a culture of equitable, inclusive, and supportive foundation that supports all members, but also all employees of CCALAC. Again, our foundation comes from our core values of partnership, equity, innovation, integrity, and service. And that's really what guides us in a lot of our internal and external collaborations with our members, and also with ourselves as colleagues, part of the organization. We're definitely have committed to advancing social justice, health equity, and we demonstrate this commitment through the changes in organizational culture that we've made in the last few years. That's also, founded in our policies, our business practices, programs, services, communication, both internal and external as well. And we also recognize that this work is not linear and that this work is also not quick. So we've essentially started this foundation in the last 2 years, and we're continuing to do a lot of that work. That is a continuous basis with different trainings and just kind of rethinking ways to operationalize a lot of these initiatives that we've come up with. Next slide. I'm going to show you all a short video of a few of our member clinics, and they talk a little bit about some of the work that they do and why they work in community health.
It's one thing to be part of your community, it's another thing to be part of it and being and serving it, giving back.
I always knew I wanted to work in a clinic setting. I did a comparison and I felt like my services were just better provided here at a clinic setting versus a private office.
Being a part of this community health center really helps us to serve Angelenos and their healthcare needs.
One of the reasons that I continue to work here is because everyone who shows up to work here believes in the mission, and it's palpable.
It's wonderful to work with a great group of other providers and be able to share stories and ask questions and learn from each other.
Being able to help people that are in positions where they need help is pretty rewarding.
My favorite aspect about my role is helping patients get better, how they improve, and hopefully try to cheer them up.
I love how passionate everyone is here, really passionate about giving quality health care to everyone.
Umma represents community in Arabic, but the root word of Umma is which is mother. And that represents, like, what do you feel when you see mother? You feel, oh, it's nurturing, it's loving. And knowing that that is a part of what Umma is about is something that, I'm about.
Being here, we're able to provide the access to care that all our patients need. Not only our adult population, our pediatric population, and our elderly population. And I feel that patients have the comfort knowing that, okay, I have a center I can go to.
You know that the people actually really care about their patients and their community. And a lot of the people who work here are from this community.
This is my first job in the medical field. I had other jobs before, but working here has improved my work ethic and skills.
I work here at Queen's Care because I have a passion for helping patients.
We are a non-profit organization. Our main goal is for helping others.
My calling is what wakes me up every morning to be here and serve our community and our patients. And then I think seeing the strength of those around me.
And I want the children of this area who look like me to see that they can reach whatever dream that they have. And I think if they can come into a clinic and see someone who looks like them, who is in these positions, it motivates them.
Right. So, some of the stories shared by some of the staff at our different community clinics really are drawn to working in community health for various reasons. Part of that is they want to help the community. They want to be able to provide equitable health care, be able to connect with people, support them with services. So, whatever it is that draws you to want to work in this field, I think it's really important to continue to think about some of that foundation and where the willingness comes in wanting to work in community healthcare. As I mentioned, we have 65 member clinics and they have 300 clinic sites all over the county. As you can see on this map, a lot of them are centralized all over, central Los Angeles, North Los Angeles, East. We have clinics in Lancaster area as well as Victorville, and as south as Orange County, and then Anaheim, Santa Ana areas. So you can find, one of our member clinics pretty much in any corner, in any community throughout LA County. So this information can be found on our website. If you go on there, you can map out the different clinics depending on where you live. It'll give you, if you put in a zip code or even name of a city, it'll pop in the different clinics that are within that area or within the mile radius. Next slide. Then some of the other CCALA services that we provide to our members is we provide resources specifically with COVID-19 during the pandemic. We supported our clinics with various resources, support with obtaining PPE, and other, resources that they needed to get through the, hardest part of the pandemic, peer learning roundtables and networks. And what this really means is that there's an opportunity for various folks to kind of get together. Let's say the HR folks that work in HR, recruitment, and all of the outreach. And so they have an opportunity to get together and really exchange ideas, be able to also receive training and education around recruitment, outreach, and retention, efforts at their clinics. So there's a variety of different groups that get together to talk about some of these initiatives within, their areas. Also pipeline programs, aside of this allied health program that we're currently starting, we also have an NP residency program, a health fellows program, the allied health, which is this one, and then also the AHEC scholars program that has been, these programs have been running at CCALAC for a few years. And then we also provide technical assistance, specifically focusing in the areas of telehealth and telemedicine. This has become one of the things that our, clinics have definitely expanded on since the pandemic began. And so it continues to grow, and the clinics continue to think about, various ways that they can continue working with their patients, not necessarily in the clinic, right? But also being able to provide something that is accessible to folks. The other piece is policy and advocacy. We have a policy cafe that happens every few months, and it's an opportunity to just hear out, what is happening within the community health area, and also be able to kind of listen to various talks and topics, of what's happening in health. So around specifically policy and advocacy, which is really important part of the work that we do as well. We have a training center, and the training center is responsible for also putting out regular trainings, and this can range from customer service all the way to nonviolent crisis intervention. There are a variety of different topics that are discussed, and there are a lot of other services. Again, I invite you, if you haven't so, to visit our website, and you can really get an idea of all of the different supportive support that we provide to our clinics and the different resources that are available to community as well. I'll hand it back over to Crystal.
Alrighty, thank you, Andres. Yeah, so right now we're going to talk about the Allied Health Internship Program, and I'll hand it to Alex to introduce it.
Thank you. So now we're going to go over a little bit about the importance of allied health professionals and why we decided to create this program. So one of the main reasons is that allied health professionals are very, very important to serving patients at community health centers. They really are the backbone of the clinic, and they are usually the first person or one of the first persons that a patient sees or interacts with when they first come in, either when they're making an appointment through the phone, when they come in, or when they are out in the community. So it is very, very important that we have enough health professionals to serve these patients. As some of you may know and might be hearing through the news, there's a huge shortage of health professionals overall, and specifically allied health professionals. So due to the pandemic, healthcare shortages are, pretty high. So that is one of the reasons why we also wanted to develop this program, to help fill some of those vacancies that have been created due to the pandemic, and also to create a pipeline for our community health centers. Oftentimes when folks think about careers in healthcare, they immediately think about hospitals, and they forget about these community health centers that really have a huge need and have a lot of vacancies and a lot of opportunity for individuals, especially those that are just starting off their careers. One of the goals for our community health, for our allied health program, is that we want to train the next generation of healthcare professionals. A lot of the individuals that are coming to our program are relatively new, might have recently graduated, might have graduated within the last couple of months. And so we are really looking to discover the next generation of healthcare professionals and train them. We want to invest in them. We want to expose them to opportunities that they might otherwise not have. And we want to train them with information that they otherwise might not receive during their program or during other school opportunities. And more importantly, we want to connect individuals to opportunities where they might receive mentorship or have opportunities to network, and of course, opportunities to receive full-time employment. So for us, it's important for us to invest in these types of programs. We currently have 2 funders for this program. One is the California AHEC program, and another one is Blue Shield Promise. They are our 2 main funders for our program. They are very excited because they see the significance of these programs. And so we are excited to have created this program. And so I'm going to pass it on to Crystal, who's going to start going over more about the program details and the program overview and expectations.
Thank you, Alex. And yeah, I'm super excited for the launch of this Allied Health Internship program. And as Alex said, the allied health professionals are really the backbone for a lot of the health clinics out there, specifically in community health. So we're really trying to place 30 students in a paid 100-hour internship externship where they're able to work at a community health center in this upcoming year in spring and summer. And prior to their internship, we will make sure that they participate in 2 fundamental virtual workshops. And as an incentive for their participation, students will receive gift cards after completing the workshops and over the course of their internship. And at the end of the internship, students will receive a certificate of completion, and depending on their internship site needs, may receive a job offer. So that's the whole overview of the program. So we're looking for 30 qualified candidates to participate in this program. And we are really want to prepare them to work at the health center. And hopefully the goal is, again, to receive a job offer at the end of the program. So that's the overview. The next thing I wanted to highlight were the program benefits. So as mentioned, this program is a paid 100-hour internship program, and that will total $1,500 total that you will get throughout your externship in the program. And throughout the program, you'll also receive $25 gift cards for each workshop attended. That's $50 total for that specific for your attendance and participation in those virtual workshops that we provide, as well as you get a $25 gift card at the start of the internship and $50 midpoint and $100 at the end, which is a total of $175 in addition to the $50 total. So we have a lot of perks participating in the program, and I think there are great incentives to keep you motivated and to really just build your career. As well, you'll have the opportunity to learn about community health centers. Maybe some of you have not worked in community health, and this program will expose you to that. And it's a great opportunity to kind of learn and also learn how you can grow your career pathway within that community health center. And also, again, the opportunity to be hired after the completion of the program. And again, that depends on the clinic's needs as well as your as well as you and how you optimize your experience within that externship. We really want folks to really show up and really give it their all and really just optimize their experience throughout this program. And at the end, we'll have a lovely ceremony where we'll award you a certificate at the end of the program and provide you with just a lovely graduation ceremony where we'll just highlight your successes and just for your completion of the program. So these are the benefits. They're really great benefits, especially if you're trying to kick off your career in allied health professional career pathway. So these are the applicant requirements. So you must complete and submit your application by the deadline, and the deadline is February 28 at 11:59 p.m. And applicants must be at least 18 years old in order to be eligible to apply. You must attend the 2 virtual workshops that I mentioned earlier. You also need to have the ability to complete a 100-hour in-person internship, and approximately that's 15 to 25 hours a week over the course of 5 to 6 weeks. And you must be available Monday through Friday for internship hours as well. be available from 8 to 5, since that's when our clinic hours are open. And also, being bilingual, especially for Spanish, is a plus, but not required. But if you're bilingual in general, that's still a plus. So, feel free to highlight that in your application. Also, you must live in the LA County area. As we mentioned, our clinics are located in LA County, and we really want folks from LA County to participate in the program. And also you must have a reliable transportation to travel to from and to and from the internship clinic site. And also you must be, again, in the last 4 to 6 months of your program area of study, or have recently graduated. So we're looking for recent grads. Again, if you already graduated, you are eligible to apply. And if you have any questions, we can go over at the end, or you can email us. And then again, must be in one of the areas, one of the accepted areas of study, which I will go more into detail in the next slide, not in the next couple slides. So another potential requirement for your clinics. So of course, in your internship site, you might have other clinic requirements required by your placement site, but these are a few that we know. In order to work at a clinic, you must have a COVID-19 vaccination and a proof of vaccination required. So just a heads up, if you haven't been boosted, get boosted. Another thing is, due to the nature of the roles and your access and interaction with various patient population, clinic sites may likely ask you for a TB test, a physical, and your immunization records, and maybe they'll ask you to pass a thorough background check. So these are some things to keep in mind when you're applying. And again, there could be other requirements that we will let you know once you're going to be placed at that specific clinic site. Alrighty, so the accepted areas of study. So we have a wide range of allied health professionals areas of study. So we're looking for medical assistant, LVNs, farm tech folks, health information technology folks, billing and coding folks, dental assistants, dental hygienists, phlebotomists, community health workers, promotores or promotoras, substance abuse counselors, patient care representative, a patient navigator, a care coordinator, admin folks, so someone dealing with customer service, reception, call center, etc., and undergraduate majors that are studying community health or health education, social work, health administration. So as you can see, we're looking for a wide, very diverse and a variety of allied health professional roles. But if you're unsure if your major of study will be accepted, please email us. We will promptly respond to you. We know that some programs have different names, but they might mean the same thing. So don't hesitate to contact us. And that's our email as well. And I will also provide my email at the end of the webinar. But yeah, these are the accepted areas of studies. So if you fit in any of those, I highly encourage you to apply. We need you, and we hope this program is right for you. So the next item I'm going to go over is the program timeline. So as you all know, the applications are already open. They open January 9th. Application interviews would be on a rolling basis. So basically, the sooner you submit your application, the sooner you'll get interviewed. And the application deadline is February 28th at 11:59. And acceptance letters will be sent around March of 2023, and the program will begin in April. Your didactic training, which is the 2 virtual workshops that are required, will be on the first one will be on April 13th, the second one will be on April 20th, and then your externship will begin on a rolling basis. Some folks might start in April, while others might start in May. It all depends on the applicant's availability. And again, the externship will end based on a rolling basis. So some might end sooner or others later. Again, it depends on the applicant's availability, but we do plan to have the program ending sometime late summer or early fall, and it all depends on the cohort of applicants that we're getting. But this is basically the gist of the timeline. So yeah. There's a lot of things moving, but I highly encourage you to check out the application. It's already live on our website. And I'll go over the program application. So the program application is pretty straightforward. We have demographic questions, which is basically your contact information. And then we have your areas of study section, which is a section where we're asking on what area of study are you currently studying or have graduated from, where you graduated from, and your availability. And then we have personal insight questions. And in these personal insight questions, we just really want to know why you want to work in community health and kind of learn about your experience working with diverse community-based populations. So these personal insight questions don't have to be super long. It could be a meaningful paragraph with 5 to 6 sentences. We just really want to learn more about you before the interview. So we highly encourage you to just write a meaningful paragraph for those 2 questions. And we also want an up-to-date resume. So that's all the application asks for. And folks can have the option to save the application and do it later or submit it right on the spot once you have all that information. I suggest to first do it on a Word document and then put those put it on our website, because sometimes our website can be funky. So yeah, that's our program application. So now with program expectations. So as I've been saying throughout this presentation, you must attend and engage in both virtual didactic workshops. So these program expectations, we really just want our cohort to really optimize their experience and just maximize all the resources given to them throughout the program. So we want folks to be curious, respectful, and present during our virtual workshops. We want folks to listen actively, promote respect, encourage open dialogue, and embrace vulnerability, because we are going to have conversations about customer service and just really, we want to prepare you in your role as an allied health professional intern during the program. And we want to invest in your professional development that will benefit your career pathways. So really, we're looking for you to really maximize again your resources throughout the program. And we want you to connect with your cohort and network. And during your 100-hour externship, we want folks to really optimize their experience there. We want folks to engage with their supervisors, find mentors, and connect with peers, and also take initiative and utilize all resources and opportunities to grow during their externship. You are going to be 100 hours might seem like a lot or a little to some, but really use those 100 hours to really just connect, and again, to really just discover your potential, invest in your career pathway, expose yourself to community health, train yourself to lead as an allied health professional, and also just connect overall to your peers and to your community during those 100-hour in-person externship experience. And during those 100 hours, there's a minimum, you can work 10 hours per week minimum, or a 25 hours per week maximum, or anything in between. But again, the minimum is 10 hours and 25 is the max, because we really want you to at least be at the clinic for at least a month. If you have a lot of availability. And again, another expectation is we really want folks to communicate and complete the required forms. We want folks to be responsive to all emails in a timely manner, and also ask us questions, because we always respond in a timely manner as well. And we want you all to complete the evaluation and alumni surveys during and after graduation from the program. And of course, once you're accepted in the program, you'll get more expectations and an orientation about that's more in detail. But this is just the gist of the type of candidates we're looking for. And with that being said, I hope you can apply now to the program. That's the link to our website. The deadline to apply is February 28 at 11:59 p.m. And we will be sharing this recording to you all in a follow-up email, and it's going to be uploaded on our website as well as these slides. And then I guess we'll transition to Q&A. That's my contact information if anyone wants to contact me. Yeah, other than that, I'm opening it to questions. Oh, I have a question. It says, would a biology major be accepted? A biology major, so if you're an undergrad, are you minoring in community health or something that has related to public health?
Or you pre-med, maybe?
Or pre-med or pre-health student?
If the answer to that is yes, then yes, we will be able to accept.
Yes, they are pre-med. So yes, we do accept pre-med and pre-health students. Again, just write it in your personal insight questions so we can kind of make that connection. Okay, awesome that you've taken community health classes. That's great. Any other questions?
Yes, I have a question.
Yes.
Hi, I'm a part of the medical assistant program with Futuro Health at Cerro Coso, and on the application, I went on there and it does ask what is the date for my completion with the certificate. I did notice I'm also scheduled to start 2 classes in March as part of that certificate with Futuro Health. So do you know more or less what are the dates that I should put on the application?
I think you can put your like an estimate of when you're gonna complete it. And again, if you're available, I still encourage you to apply to the program. So that should be fine.
Okay. And I have another question. I'm sorry. The COVID vaccination and verification. I've had my 2 shots, and then I would still need to be boosted.
Yes, I believe the clinics that's like a CDC guideline, and all of our clinics follow that guideline. So I do recommend for you to be boosted.
Okay, awesome. All right, that's good. And then one last question.
No, go
At
ahead.
at the start of the medical assistant program with Futuro Health, there was, I remember being in a presentation where there was an option to be to learn to be a phlebotomist, and I don't know what would be the easiest way for me to actually do that to actually get that certificate as well.
Well, we are not giving any like certificate like licensure for like any of the allied health professions we mentioned. We expect that for you to get from the school that you're studying at. So
Okay.
if that's like a certificate that you're also getting, good for you. So like feel free to add that also in your application if you have both, like if you're a medical assistant and a phlebotomist, you can add that as well. Or like you're working on getting that certificate or licensure as well.
Okay. All right.
Yeah, that certificate would have to come directly from the school. If they issue you then the phlebotomist certificate, then you could practice it at one of the clinics as part of the internship, but they would have to issue you that certificate first. The school would have to.
Okay.
Yeah, but that's awesome. So that's great. Is there any other questions? Oh, I think there's a few on the chat. Oh, there's a question asking, what are some typical responsibilities of interns? How do those responsibilities intersect with medicine and community health? So typical responsibilities for the interns are going to vary depending on the allied health profession that you fall into in that category. But again, we just launched this program this year, so our clinics are also applying to host an intern as well, and they're going to provide more in detail the responsibilities that they're looking for. But something that we're really going to highlight is that you're going to be, as an intern, you're going to have the opportunity to shadow folks, but as well as the opportunity to do the things that you studied for. So it would be like that specific, like if you're studying phlebotomy, you're going to be doing phlebotomist work, which are like the typical responsibilities that you see in a job description. But throughout the program, you'll have the opportunity to be guided and have the resources by having a preceptor. And again, just being able to shadow folks and really just, as an internship experience, we want folks to really just benefit from all avenues. And we will also provide you with during the workshops, we'll provide you with trainings that will supplement you in your career pathway. So again, it's a new program, but the typical responsibilities are going to vary based on the area of study.
Yeah, and just to add a little bit more, usually there's some kind of project that you get assigned. So it might be a project on COVID or on increasing colorectal screenings or on working with the diabetes patients, what have you. So usually there's some kind of project that's assigned to you. But also for this particular program, since it's kind of consider it like a long interview, so they're kind of checking to see if you might be a good fit to be hired, but you're also checking them to see if they are a good opportunity for you to work there. So it's also an opportunity for you to express to them your interests, like, hey, I'm interested in diabetes, or I'm interested in X, Y, and Z. So once you're there, talk to your preceptor, say I'm interested about this, and they might be able to expose you to certain opportunities there within the clinic.
Mm-hmm. And just to add to the next question that they asked, how do those responsibilities intersect with medicine and community health? It's hands-on. Like, you'll be there and present, and you really get exposed to community health. And it's just a great opportunity because you kind of see how close-knit all of the providers and healthcare workers that work in community health kind of work as a team. So it's a very hands-on experience. And there's a next question asking, will I be allowed to complete more than 100 hours? The requirement is to complete 100 hours, and that's basically the requirement also for the clinics for you to complete 100 hours. I don't think, so after the 100 hours, I hope you get the potential to be hired after, but I don't know if Alex, you want to add more to that question.
Yeah, I think it's because like for medical assisting, they need to complete, I think it's 140 or 160 hours. So I think that's why they're asking that question. So I think the answer would be yes.
Yes. So yes, you will be.
But 100 hours would count for our program for you to get the $1,500, and then any that you do extra is just between you and the clinic. Awesome. But they would welcome it. They would be more than happy for you to be there longer.
Awesome. Thank you, Alex. Another question is, would applicants also be able to apply for other CCALAC programs such as AHEC Health Scholars? If you qualify, we encourage you to apply to the other programs. I'm not sure if the AHEC Health Scholars right now are still looking for applicants. Andres, if you want to add to that.
Yeah, we definitely are. The application is going to be open again, I believe, through the end of the month. And then we're closing it at the end of the month for the year until our next cohort, which will start back up again in October of this year.
Yeah, so definitely check out our resources. If you see other programs that you think you qualify for, we highly recommend for you to apply as well. Is there any other questions? I'm taking your silence as a no. So I hope this informational webinar provided you with more insight on our program, and we hope to see your application come through. We're really excited again to launch this program, and we're just excited to see all the potential candidates that might work in community health with us. So with that being said, I guess I'll adjourn this webinar. Thank you so much, everyone. And I guess I'm going to stop the recording now.